Okay, we have 15.
Andrew, could somebody invite me in? But my camera's not going on, please.
Okay, I'm going to make the opening statement now. The council meeting has now commenced. Can I welcome all members and officers to this meeting of the council, which due to government advice to practice social distancing, this meeting will be held virtually. The meeting is being recorded and will be available via the council's website to be viewed following the meeting. Everyone participating in the meeting will be accessing this meeting from remote locations. Please could everybody ensure that mobile phones are switched off or are in silent mode. Members will have received an electronic copy of the agenda. I will ask officers to present a summary of the key points. For the record, the agenda can be viewed on the council's website. Members and officers will be speaking at various points during the meeting, and those speaking may switch their cameras on at that point. But I would ask that, with the exception of myself as Mayor, at all other times you keep your cameras and microphones switched off, as this will help to minimise any background noise and interference and to ensure the connection remains as stable as possible. If any members and officers wish to raise a point or question, they should use the instant messaging IM icon in the bottom left of the Skype window and simply type speak. And I just wish to emphasize that nothing else should be put in that instant messaging, either speak or question. And then I will come to you in the order I receive requests. Please do not use your microphone until I invite you to do so. In the event that the council requires to vote on any item of business before it at the meeting, I will announce that members of the council have 20 seconds in which to vote by typing for, against, or abstain in the instant messaging icon. I will then ask Democratic Services to announce the decision made by the committee. In the event that a recorded vote is requested at council, I will ask the members to switch on their microphones, and the Democratic Services Officer will conduct a roll call of each member, asking whether they are for, against, or abstain from the recommendation in a report, before announcing the outcome of the decision. Officers from Democratic Services and ICT will be supporting this meeting and will be monitoring the use of microphones throughout, and where necessary will mute those not being used. Before we formally commence, I will now ask the officer from Democratic Services to announce the names of the councillors in attendance at this meeting. I would also ask the officers to introduce themselves as and when I invite them to speak during the course of the meeting. They too should ensure microphones and cameras are switched off when not in use. Right, Andrew, can I have those in attendance, please?
Yes, certainly, Mr. Mayor. For the benefit of the recording, my name is Andrew Rees, Democratic Services Manager. All members of council are present today, with the exception of Councillor Venables, Councillor Spanswick, Councillor Rowlands, Councillor Martin Jones, and Councillor Tilsley and Councillor Aspey. Thank you, Mr. Mayor.
Thank you, Andrew. Before we go any further, I just wish to announce a change in the agenda listing. The leader has a commitment later, so item 4 and 5 on the agenda will be swapped around. In other words, the leader will precede the announcements from members of the Cabinet and Chief Executive, except for myself. I will still be going first. Okay, apologies for absence. Andrew, I do have one other, and that's Councillor Spanswick. I've received an apology that he is not present.
Thank you, Mr. Mayor. I also have apologies from Councillor Tilsley and Councillor Venables. Thank you, Mr. Mayor.
And I have a note that Councillor Tim Thomas will be late to the meeting. Okay, item number 2, declarations of interest. Does any member have a declaration of interest, please? I will take the silence as being none. Thank you. Approval of minutes. Can I receive approval for the minutes of a meeting held at Council on the 18th of November 2020? Can I have a mover, please?
Move.
Thank you. Seconder?
Seconder. Second, Chair.
All in favour? Thank you very much.
Right.
Thank you very much. Then we move quickly on to item number 4, and that is the announcements from myself. Good afternoon, everybody. I hope that everyone is keeping safe and well. As you are all aware, it is with great sadness that we learnt recently of the passing of our colleague and friend Kevin Stevens from the effects of COVID-19. Many of you will personally know Kevin, as he was a very well regarded member of the Democratic Services team. Indeed, he would have been here today assisting at this meeting of Council, making sure that everything ran smoothly. Kevin has been a dedicated and hard-working member of BCBC for over 25 years and has in that time made many lifelong friends across the authority. Our thoughts and support therefore go out to those staff who are coming to terms with the loss of their friend and colleague. Kevin was also a proud family man, and in their time of loss, we send our heartfelt condolences to his wife Annie, his sons Jamie and Luke, and his mum Elsie, all of whom I, as Mayor, and my consort, Councillor Julia Williams, met outside the church yesterday prior to the funeral ceremony. As a mark of respect and in Kevin's memory, I would ask that we all now observe a minute's silence. Thank you. Okay, thank you for that, everybody. Carrying on with my announcements, I had the pleasure last week of saying thank you to all our social services staff and volunteers who made the Santa Appeal possible this year. As you can imagine, organising the collection while complying with the pandemic regulations was challenging for everyone involved, especially as the number of nominations of families in need has increased to over 300 children and young people. It is a credit to our partners, therefore, Brackler Tabernacle Church, Bridgend Tesco, Hafod Iwenna Hospital, and of course the wonderful Brinteg School Year 9 pupils that made the appeal so particularly successful and will reach as many children and young people as are in need. And just briefly, I would just like to say I had the unique experience and dubious pleasure maybe of making a short video by the Christmas tree in the town centre 2 weeks ago, introducing this year's digital Christmas festival. I gather now that the Facebook page has reached over 24,000. So I like to think in some way it has been helpful to the business community survive during this terrible time and promote their Christmas sales. So that was a worthwhile venture. Thank you very much. I will now call the leader for his announcements. Thank you. Leader.
Thank you, Mr. Mayor, and thank you for allowing me to give my announcements earlier than is indicated on the agenda. The reason I asked for that is because I have been asked to attend an urgent meeting with the Minister for Health and Social Services to discuss the rapid escalation in the number of COVID-19 cases across South Wales. That meeting is at 3:30. I will rejoin the full council meeting as soon as I can, Mr. Mayor. I am relieved and pleased to inform members that Councillor John Spanzik has been discharged from the Princess of Wales Hospital and is now recovering at home. Following a positive test for coronavirus, John became very ill and was admitted to intensive care after developing pneumonia. Since his discharge, he's felt well enough to post a statement to his Facebook page, and I'd like to read part of it to you now. Just over 2 weeks ago, I tested positive for COVID, and for the next week, I curled up and slept. 1 week later, unable to breathe properly, I was admitted to Princess of Wales Hospital, and that's where our amazing NHS staff took over and gave me the best treatment I could ever have wished for. After several scary moments thinking I may not be coming home, I have been one of the very lucky ones. The reason for this post is to give the biggest shout out possible to all of the staff working in the hospital who turn up each day to battle with this dreaded COVID, and to all of the patients who desperately need their help. Most of the staff have had COVID themselves, yet they still turn up for work to make a difference in what are now very difficult circumstances. I will never be able to thank all of the NHS staff enough for the care and treatment they have given me, but they are the true heroes of our country. We all need now to play our part to help avoid the COVID spreading any more rapidly. I know that all members will join me in wishing John well as he continues to recover at home. He is right in warning that the situation is quickly becoming dire. Just a few hours ago, Welsh Government announced that Wales is moving to alert level 4 and that a series of new national changes will be implemented. All non-essential retail, including close contact services and all leisure and fitness centres, will close at the end of trading on Christmas Eve. All hospitality premises will close from 6 p.m. on Christmas Day. 28th of December, tighter restrictions for household mixing, staying at home, holiday accommodation and travel will also come into force in Wales. £340 million will be made available by Welsh Government to support businesses affected by restrictions into the new year, and further support has been promised for businesses affected by the new restrictions. Closer to home, some important council services are now at risk because local cases of coronavirus are continuing to rise. In less than 2 weeks, Bridgend County Borough has moved from being one of the most improved local authorities in Wales to becoming the third highest area for positive cases of COVID-19 in the country. Directorates are currently in the process of identifying services that are absolutely critical for preventing threats either on the basis of serious damage to human welfare or serious damage to the environment. These are definitions of emergency as defined by the Civil Contingencies Act. And this is the first time in its history that this council has had to seriously consider such radical actions. This clearly indicates the level of crisis that we are in the process of responding to. And the Cabinet Member for Social Services and Early Help is going to say more about this shortly, and the decisions we've had to make about social services. High numbers of school-based staff who are self-isolating or ill with coronavirus has already forced one comprehensive, a special school and 6 primary schools to close earlier than planned. Council staff are already working flat out to provide vital services in very difficult circumstances. But any further reduction in our workforce will have a major impact on our ability to do so. We're now in a position in which we've been forced to start considering which services will need to be cut back and reduced. I know that colleagues in health are experiencing acute pressures too. And the First Minister has of course confirmed that a further national lockdown will take place after Christmas. Ultimately, it is down to us as residents of the County Borough to determine what happens next and whether it will become necessary for further drastic measures to take place locally or not. I hope that members will support the fight against the spread of the coronavirus by telling their constituents at every opportunity that it must be taken seriously. We need everyone to think about the possible consequences of their actions and to follow the rules on wearing a mask, socially distancing, washing hands, and following the guidance. We are, after all, in this together and need to take urgent action now to protect our friends, family, neighbours and ourselves. Thank you, Mr. Mayor.
Yeah, thank you, Leader. We'll see you later. Thank you. I now move on to the Deputy Leader, Councillor Williams.
Thank you, Mr. Mayor. As Councillor Howard Williams, Deputy Leader. My announcement is regarding the Christmas and New Year recycling and waste collections. But there will be one very important change that I hope members will make people aware of. We are asking households where someone is showing coronavirus symptoms to make sure that any tissue waste, such as kitchen roll, toilet paper or wet wipes, is double bagged and set aside for 72 hours. After this, the bag can be placed out in the household rubbish bag. This will help keep our collectors safe. On no account should such waste be included with paper recycling. Collections this year will be carried out as normal on Christmas Eve and New Year's Eve, but not on Christmas Day, Boxing Day or New Year's Day. Waste that is due to be collected on Christmas Day will be picked up on Sunday the 27th of December, and collections due on New Year's Day will be picked up on Saturday the 2nd of January. With Boxing Day bank holiday move into Monday the 28th of December. Collections will take place as normal on this day. Residents will also be able to put out one extra rubbish bag for the first scheduled refuse collection after Christmas. This will be there will be an additional vehicle collecting cardboard, so this can be collected separately. I'd like to ask members to remind residents that there is no limit on how much recycling can be put out for collection and that the vast majority of materials can be recycled. The main items that cannot be recycled are cards that have glitter on them, wrapping paper, plastic, black plastic, cellophane wrap, bubble wrap and polystyrene. Finally, real Christmas trees can be taken to the local community recycling centre. Thank you.
Thank you, Deputy Leader. Moving on now to Cabinet Member for Communities, Councillor Richard Young, please.
Yes, thank you, Mr. Mayor. I've got one announcement. I'd like to provide members with a brief update on the Community Asset Transfer Programme. Rest Bay Sports, which represents FC Porthcawl and Porthcawl United, have become the latest organisations to take advantage of the initiative. They have taken over the self-management of rest-based playing fields and pavilion under a renewable 5-year lease and have been awarded just over £45,000 towards the cost of redeveloping the pavilion, with a further £10,000 provided to secure pitch maintenance equipment. The clubs intend to transform the outdated pavilion by extending and refurbishing the first floor level and providing an elevated balcony overlooking the playing field. We are continuing to support a large number of sports clubs while they undertake the self-management process and are planning to recruit a community asset transfer surveyor to strengthen the process. As of October 2020, we have received expressions of interest for the management of 53 outdoor sports facilities and park pavilions. And by November, a further 10 bowls clubs also agreed short-term tenancies. A number of additional transfers to sports clubs and town and community councils are due to be finalised in the coming months. So I'll bring you further news on this soon. Thank you, Mr. Mayor.
Thank you, Councillor Young. Next is the Cabinet Member for Social Services and Early Help, Councillor Nicole Burnett, please.
Thank you, Mr. Mayor. The leader has already outlined the serious situation that lies before us as a result of the increase in cases of coronavirus and how directorates are taking steps to ensure that it can be managed effectively. From the perspective of social services, there are a number of elevated risks as a result of an increase in staff absences, either because of COVID-19 or due to the need to self-isolate. For example, capacity among our internal and independent domiciliary care providers is currently tight, so any further reduction in that workforce may mean that they are unable to meet all care and support plan requirements. While there is capacity within residential and nursing homes and across our children's residential care service, the situation remains similarly fragile. To accommodate this, a number of key actions are taking place in line with our business continuity plans. Firstly, essential services are being regularly reviewed, prioritised and coordinated at a director and head of service level. The prioritised service areas across both adults and children's social care include safeguarding, care for the most vulnerable, mental health assessments, case management for vulnerable children, residential care and services that support fostering. Provision of respite care and day services will be kept under constant review until the situation improves, and we will be contacting affected individuals and families to explain any changes that may be needed and to provide support. Secondly, work was carried out at the start of the pandemic to determine whether staff had previous experience of working in, for example, direct care services. As a result of this forward planning, staff are now being redeployed to support operational managers. A basic training package is being put in place as part of this to ensure that redeployed staff can help deliver frontline services efficiently, and they are also being paired with regular staff to maximise their effectiveness. In addition, we are working with the finance team to establish a fast-track process for direct payments, which can further facilitate care and support. The situation before us is both challenging and fluid, but we have an extremely experienced director and senior management team in place to deal with it, and I am confident that the authority is in safe hands. I should stress that while this is a temporary situation, how long it lasts for will ultimately be determined by whether the pandemic infection rate for Bridgend County Borough continues to rise or fall. In this respect, we truly are in this together, and I fully support the leader to ask people to observe the guidance and to help spread coronavirus. This is the first announcement that I've made as a cabinet member, and it's not an announcement that I'm happy to report. So please don't be tempted just to pop in for 5 minutes while delivering your presence this year. Just follow the rules so that we can get out of this. Our staff are flat out and exhausted already. Thank you, Mr. Mayor.
Thank you, Councillor. Next is the Cabinet Member for Wellbeing and Future Generations, Councillor Danisha Patel, please.
Thank you, Mr. Mayor. I just want to bring members' attentions to one item today, and that is that our enforcement officers are continuing to visit premises across Bridgend County Borough to ensure that they are meeting their responsibilities to both customers and staff whilst we're in a pandemic. There's already been a lot of media interest in this, so some members may have picked up on the coverage of local businesses which have received improvement notices following inspections from the Shared Regulatory Services enforcement teams. For those who aren't aware, the enforcement generally takes the form of a premises improvement notice, which specifies the measures that need to take place to meet the regulations, and this is within a certain time limit. If the business fails to comply, the enforcement officers can issue premises closure notices, which remain in place for up to 14 days. In some circumstances, enforcement officers can close the premises immediately without having to serve improvement notices. But this would be only where there is a serious breach of the regulation. Thankfully, this has not been proven necessary in Bridgend so far. I'm happy to report that the majority of the premises which have been inspected and which have received improvement notices have complied in full and have been able to continue trading. If a constituent of yours or a business within your ward would like more information about this, then please could you direct them to the Shared Regulatory Services website. I would like to take this opportunity to thank the Shared Regulatory Service and particularly the enforcement team for continuing to do all they do to keep us safe in Bridgend. Thank you.
Thank you, Councillor. Now for the Cabinet Member for Education and Regeneration, Councillor Charles Smith, please.
Thank you, Mr. Mayor. I thought colleagues might appreciate a brief update on what's currently happening with our local schools in the run-up to Christmas. As you all know, Welsh Government has introduced national measures for all schools and colleges across Wales. In Bridgend County Borough, all secondary schools, including sixth forms, have now moved to online learning only. After today, all infant, junior, primary and special schools, including the Bridge, will also move to online learning, and this will be in place for the rest of the week. Unfortunately, a number of schools have had to bring these plans forward early. This is due to the high number of staff and teachers who have either contracted coronavirus or are self-isolating as a result of coming into contact with someone who has tested positive. Mr. Mayor, I'm sure members will join me in thanking and congratulating our school staff and teachers for their ongoing hard work and commitment, and for ensuring that pupils can continue to receive lessons in the most difficult of circumstances. As regards children who are eligible for free school meals, I'm pleased to confirm that we have once more arranged food parcels to be delivered in readiness for the Christmas holidays. Each parcel covers a 2-week period and is being delivered to the home addresses of all eligible pupils. Those who are of secondary school age will also receive an additional food parcel to take account of the online learning arrangements. Thank you, Mr. Mayor.
Yes, thank you, Councillor. Yes, and I go along with your remarks about the teaching profession. Difficult time for them at the moment. Thank you very much. Now over to the Chief Executive, please. Mark Shepherd.
Thank you, Mr. Mayor. Yes, Mark Shepherd, Chief Executive. A very brief announcement, Mr. Mayor. I'd just like to remind members that public consultation has started on the Bridgend Town Centre Master Plan, and to ask you to encourage local residents to take part in it. If you haven't already had a chance to look at it, this is a hugely ambitious 10-year strategy with a number of long-reaching aims. It includes a wide range of proposals, such as creating a new town square, moving Bridgend College into the town centre, transforming derelict and empty buildings into new shops and housing, and much more. We have worked alongside specialist consultants to produce the master plan. It aims to increase the number of people who shop, work, live, visit and enjoy the town centre by using a zoned approach for cultivating retail opportunities, creating new commercial and office space, introducing new public realm works and providing better transport facilities. We've already obtained views and feedback from business owners and wider stakeholders, so now we need to know what local residents think about it as well. The consultation is going to be live until the 1st of March next year, so there's plenty of time for people to take part. They can do this in a number of ways, all of which are detailed on the consultation page of the council website. Thank you, Mr. Mayor.
Thank you, Chief Executive. I now move on to item 6, which is the report of the Chief Executive. Do you wish to introduce it, Mark?
If I may, Mr. Mayor, I shall just say again a few brief words of introduction, primarily just to remind members that I think this is the last of these presentations of the calendar year. You recall that we've had presentations from South Wales Fire and Rescue Authority, Cardiff Capital Region City Deal, Valleys to Coast and the Police and Crime Commissioner and Chief Constable of South Wales Police. What we will be doing is meeting with group leaders shortly to review and assess the success of, I suppose, what was a different way of approaching council meetings this year, to determine next year's programme, and also perhaps determine whether indeed there should be additional people that perhaps should come and present to us. For example, maybe Owen and Halo, who run our cultural and leisure facilities. But that'll be something that we will do before determining next year's programme. For today's presentation, Mr. Mayor, we have with us, I believe, Marcus Longley, the chair of the board of Cwm Taf Morgannwg, Paul Mears, the chief executive, and Alan Lowry, who is the executive director of operations. It is inevitable at the current time, and you've heard this based on the announcements, that there will be some sort of a focus on COVID. What I would say is that Cwm Taf Morgannwg are, of course, incredibly important partners at any time, and we're fortunate that we have a good relationship with them. And of course, on matters such as the integration of our social care and health services, they've been incredibly important partners for a while. During the pandemic, we have found ourselves meeting and engaging with them much more regularly. So the Chief Executive and I have a weekly meeting with the Chair and Chief Executive, and of course the Corporate Director of Social Services likewise, and her team also meet regularly. So I think without further ado, Mr. Mayor, I think the intention is that there's a relatively short PowerPoint presentation from our colleagues, and then in your hands in terms of the question and answers that may follow, Mr. Mayor.
Thank you, Mark. I'll invite then the representatives from Cwm Taf Morgannwg to start their presentation. Will that be the chair or the Chief Executive Office?
It will. Sorry, can you hear me now, Mr. Mayor?
Yes, I can hear you.
Yeah, I got a stutter with my finger. Obviously, I kept turning the mute on and off. Apologies for that.
Okay.
Yeah, thank you very much, Mark and Mr. Mayor, for inviting us this afternoon. We're very grateful. And perhaps just to start with, I could just echo the leader and Councillor Burnett, their statements that immediately preceded this. As you know, the health service is under exceptional strain, and the signs are that strain will increase. But we're incredibly grateful for the partnership working with your leaders and with your staff, which, as the Chief Executive just said, have been excellent in this really difficult time. Without that strong partnership working, we simply wouldn't have been able to cope. So we're really grateful for that. Can I also just begin by apologising? I also need to join the meeting that the leader has left to join. So I'm going to just briefly open this presentation and then hand you over to my two colleagues, who I'm sure will more than be able to answer your questions. So thank you very much for that.
Thank you, Chair.
We're dealing with these slides remotely, I'm afraid. So Andrew, are you able to turn to the next slide? Brilliant, thank you. So that's just very briefly what it was we intended to cover today. You'll see COVID-19 there slap bang in the middle, because clearly that is the issue of most urgency. But we do want to touch on some of the other points, because this is really about looking to the future. COVID eventually will come back under control, and then all the other strategic issues that we need to face will be there for us. Next slide, please. So just very briefly, last 12 months, it seems almost unbelievable that so much has happened in 12 months, and I'm sure it's the same for you too. It's been a really tricky period of time. But this is just a sort of some of the key things from our side of the fence, as it were, that we've been up to. So we had just over a year ago now a very important joint review into quality governance in the Health Board, which reminded us of a series of challenges that we need to face. And this, of course, is linked into the problems that we've had in our maternity services in the old Cwm Taf Health Board area, not Bridgend, but the other two centres. So that has been that is and remains a key issue for us, and that links to the second bullet point there. So that the Health Board was put in special measures for our maternity services, and also we're in targeted intervention for aspects of our quality and governance arrangements, which links to the first bullet point. So that's very much live, and a lot of work is taking place despite COVID in those areas. Third, we have introduced an entirely new way of running the organisation. So as you know, the Health Board is quite big. It spends about £3 million a day. And we've got about just under 15,000 people working for us. So introducing a new operating model, a new way of organising the organisation is quite a big deal. And we've spent a lot of time on that, and it's already starting to improve our ability to manage the service, and it's been tested severely. By the next bullet point, the response to COVID-19, a huge challenge for us, and I'm sure we'll hear more about that in a minute. Next bullet point, we have appointed a new chief exec, Paul Mears, who is delighted to say is with us here this afternoon. And Paul has already making lots of changes in the organisation, which is excellent. The penultimate bullet point there, the launch of what we call our Cwm Taf Morgannwg values and behaviours, which sounds, if we're not careful, a little bit like management speak. It's anything but. This is about tackling some of the cultural problems that we've had in the organisation for a little while, which are highlighted in the maternity work and the targeted intervention. A fundamental piece of work to make sure, for example, that all our staff do feel confident to speak up, that things will happen as a result, that we care for each other and work as a team, and we're a learning organisation. Again, we'll have a little bit more of that in a minute. And then finally, a focus on stakeholder engagement. Again, if we're not careful, that sounds like jargon, but it is about working at those relationships that I've already mentioned, with yourselves, with the other two councils that we cover, with the third sector and the hundreds and hundreds of charities that are working in this area, and with the private sector and so on. Again, just to re-emphasise that point, we cannot do what we need to do unless we do that in partnership. So I'm going to hand over now to Paul, if he's there. I hope he is. And I'm afraid I'll have to give my apologies and join this meeting with the Minister. Mr. Mayor, thank you very much.
Thank you, Mr. Longley. Thank you very much. Is Paul there? Yes,
yeah,
he is.
I'm here, Mr.
Good.
Mayor. Good afternoon.
Good afternoon.
And just to echo Marcus's thanks for inviting us along. As he said, I've been in post now for 3 months, so I have joined the organisation at a very challenging time. But what I'll just talk you through now is some of the things that we're going to focus on moving forward, and some of the themes that I know will be of interest to you, particularly in the Bridgend area. So if I can have the next slide, please. So looking forward to the next 12 months, Marcus has articulated some of the things we've been dealing with in the past 12 months. Obviously, COVID is absolutely front and centre of our work at the moment. It is taking a lot of our time, and the majority of my time and my colleagues' time in managing that. But having said that, we know also that we have a range of other things that we need to do to ensure we deliver good, safe, effective healthcare services to our population. What we're aiming to do in the new year is start to look forward and really understand what we need to be doing in terms of health and care over the next 5 years. We've got a lot of, as Marcus said, a lot of services that we provide. We have just under 15,000 staff. We operate out of about 40 odd facilities across the Cwm Taf Morgannwg area. There are lots of advances in medicine today, which mean that the way we deliver services in the future will need to look different to the way we've done those in the past. We've learned a lot through the COVID period, actually. Whilst it's been extremely challenging and for a lot of our staff, there's been a lot of innovation that's happened in a very short space of time to try and react to the COVID situation. And we need to make sure that we take some of those forward into the future as well. So having a clear strategy for our organisation is really important to provide the framework for our staff to understand where we're going, but to be able to communicate and share that with our stakeholders, our partners and our communities. As Marcus mentioned, we've implemented a new operating model this year. Basically what that means is that we've divided up the organisation into 3 delivery parts. So we've tried wherever possible to make those as coterminous as possible with local authorities. So in your area we have a Bridgend integrated locality, and that team are responsible for running all of the healthcare services that we provide in Bridgend. So that would include the Princess of Wales Hospital, Maesteg Hospital, mental health services, community-based services such as district nursing, rehabilitation, primary care services, working with colleagues in dental services. All of those services are now managed by a local team in Bridgend. And for us, what that is, why that's really positive, is it means that we can really strive to build the relationships with local stakeholders. So we already have, as Marcus said, very good relationships with your colleagues in social services in Bridgend. We want to continue to build on that moving forward, and it's really important to us that we have those local relationships with our senior teams operating on the ground in Bridgend. I'll come and talk about COVID in the next slide, because clearly that is a key priority for us moving forward. But obviously the other challenge COVID has brought is not just managing the here and now of the pressures that we're facing. It means also that we've had to unfortunately cancel many of our planned elective operations and outpatient services to enable our clinicians to be freed up to focus on dealing with COVID. And what that means is we have a large number of patients now, several thousand patients, who are waiting for planned surgery that's unfortunately had to be delayed. So when we are hopefully starting to come out of this situation in the next year, we will have a significant challenge to face in terms of clearing and working through the backlog of activity that's unfortunately had to be postponed. So that will be a big focus for us moving forward. Next point I've said there is about population health, and that sounds a simple thing to say, but I think we will all appreciate that often as a health service we're dealing with the consequence of ill health. We get involved with people when their health is deteriorated and they need help from either their GP practice or the hospital or mental health services. What we really want to try and do is, working with our partners, get upstream and try and work with communities and people to try and ensure they're living as healthy a life as possible, so that actually we stop them getting ill. We try and prevent the rise in things like diabetes and heart failure by giving advice and support for managing diet, exercise. Obesity is a big challenge for us in our communities. If we can try and get upstream and manage some of those things early, it does mean that we provide a better outcome for our local communities, but it also means as a health service we are going to be able to manage and to contain the huge growth in exponential growth we're seeing in demand for services. So we really want to try and shift our focus away from being reactive to being proactive and upstream, and that will be a key part of our strategy moving forward. But obviously we can only do that if we work in partnership with colleagues like yourselves in the council, voluntary sector organisations, because much of what determines people's health is not actually delivered by the health service. It's their housing, employment, education, other factors in their communities. And really developing our partnership, working in integration with yourselves and the council will be a key priority for us moving forward. And finally, the point there I mentioned there about the digital solutions. As we all know, indeed, today's a good example. We've all had to adapt in a very different way to the usual ways we've used to working. We believe very strongly now that the healthcare world is changing very much, and more of our services can be delivered remotely using digital solutions. So it's really important that we maximise those opportunities moving forward. Next slide, please. So in terms of the COVID situation, I mean, obviously the leader and other colleagues from the council have described some of the real challenges we're facing in Bridgend, but that's common across the whole of the Cwm Taf Morgannwg area. We have very, very high rates of infection at the moment in our area, some of the highest in the UK actually, not just within Wales. And we've seen that growth exponentially grow over the past few weeks. It is putting a massive pressure on us at the moment. Just to give you an indication, in Princess of Wales Hospital, we currently have 116 patients with COVID, either actively with COVID or recovering from COVID. And you'll know that we have in your locality opened a temporary hospital, Ysbyty Seren, in Bridgend, which currently has 53 patients who are all recovering from COVID-19. So we have a huge challenge on our hands to try and manage the consequence of COVID. Obviously, throughout the pandemic, we have been working on the Test and Trace and Protect programme, and I have to say that's been a huge success in terms of working with local authority colleagues. It really has been a great example of how when we work together we can deliver some amazing things in very short time. And we've also begun whole population testing in Merthyr Tydfil and in the Upper Cynon Valley, where we had particular hotspots a few weeks ago. As I said earlier, there is a bit of a light at the end of the tunnel. We now have the vaccination for COVID-19, the first one of which has now come into our area. We began our vaccination programme on the 9th of December. We started in Bridgend vaccinating staff in Princess of Wales and in other community from other community teams, and that's now being rolled out again across the rest of our patch. In the new year, we will anticipate to be expanding that programme out into the wider community, including care homes, other settings as well, and we anticipate that the other Oxford vaccine will probably be coming on stream hopefully in the new year, which will facilitate that. The other area where we work very closely with council colleagues is obviously in the management of patients who are ready to be transferred out of hospital into the community to a care home or their own home with a package of care, and we work very actively with your colleagues to make sure that we try and minimise the number of people we have waiting. But obviously, as we heard earlier from your colleague who looks after social services, we know also that social care has equally been hit by the COVID-19 pandemic in terms of staffing, and so it is a real challenge for us at the moment to make sure that we can get patients out of hospital back into their own homes safely within the guidelines of infection control, but also making sure that they've got the appropriate support available to support them in their own homes. So it has been a huge challenge for us. We anticipate as a health board that the next few weeks are going to be significantly challenging. We know looking forward to January that we will see a large spike. We anticipate continuing to grow as the transmission rates in the community grow, and that is going to mean that we're going to have to look very carefully over the next few days about what services we can continue to provide in Christmas and New Year periods, and what we may have to stand down to enable us to staff some of our critical services safely. The next slide, please. Just to go back to what we're actually trying to achieve as an organisation, we want to build healthy communities together, and we want to help people live their lives as healthy as possible and be involved in their health and care choices. And I thought it was just helpful to share with you some of our strategic objectives, which I'm sure will be some of which will be very similar to the sorts of objectives you will have within the council. Next slide, please. I thought it was also important just to highlight to you that obviously Cwmtaf Morgannwg is a relatively new organisation, having been founded in April 2019 when the Bridgend locality transferred over from the Swansea Bay Health Board, which was called previously ABMU, and we actually created a new organisation of Cwmtaf Morgannwg on the 1st of April. And I think it's fair to say that our colleagues from Bridgend were very pleased to be coming over to the new organisation, but we also recognised that there were some areas where we needed to make sure as a new organisation that we paid attention to making sure that Bridgend colleagues felt as integrated as possible into the new organisation, and that's part of the rationale for why we created the new structure we have, with a clear focus on that particular locality. I'd also like to just highlight, the really great example we have in Bridgend of health and social care integration. I've been out and visited the health and social care team in Bridgend and met with the people leading it, and it's really great to see how joined up our services are for local people in Bridgend, between health staff and social services staff for adults. And you'll all know from your own experiences, I'm sure, often it is that interface between health and social services, which is the area within which patients often can find it quite difficult to navigate, and families can often feel that they're ending up bouncing back and forwards between different bits of the system. It's been great to hear from colleagues in Bridgend of how we've tried there to make that as seamless as possible for patients and their families, and it's certainly something we as an organisation want to take and help spread that experience into the other parts of our areas where perhaps we've got further work to do on the health and social care integration journey. Next slide, please. Just also to highlight some of the examples of the great joint working we have already with council colleagues. And obviously much of this work is managed through the Regional Partnership Board. We've had an additional £10.9 million of government funding to work across multi-agency to develop a range of plans to support our collective ambitions as organisations, focusing particularly around community care, support for people in their own homes, supporting the development in primary care, the GP services and others. We've invested in our mental health services because we recognise, particularly in the current climate, they are under very much deep pressure. We've increased capacity in our emergency department and also looked at how we can try and provide alternatives for people coming into the emergency department through services in the community that people can access where otherwise they may have gone to the A&E department at Princess of Wales. And we've also looked at how we can improve our discharge pathways and to get people home as quickly as possible. Next slide, please. Just also to talk to you about our responsibilities around primary care. As you may know, we are responsible for providing primary care services in the area. Much of that is delivered by general practitioners who are contracted by the Health Board. We have currently 16 practices in Bridgend which support the registered population of around about 157,000 patients. And what we've done quite over the past few years is try to group the GP practices together, because we believe strongly that there's an opportunity as GP practices work more closely together, we can provide better networks of services to local patients. So we have 3 networks of primary care clusters in Bridgend. We also have 18 dental practices who we are responsible for, and 19 optician practices that we're responsible for. And there's been a lot of work in the primary care space over the past year or so, and plans to continue that moving forward. The development of the Bridgend Health and Wellbeing Centre. We're looking at how we develop the further practices, and we've begun now to look at implementing the 111 service. So for people who have non-urgent needs, rather than phoning 999, they're able to access the 111 service, which is effectively a front door into the NHS, which enables them to get advice and support, perhaps be directed to an alternative to hospital as a first port of call. And we're also looking at rolling out a model that's been trialled in Cardiff at the hospital there, where people can actually phone ahead and book an appointment at A&E if they do need to go into A&E, rather than turning up and waiting for a long amount of time. They can actually turn up and book an appointment for a non-critical appointment if they need it. And we're also trying to work with colleagues in the optical services to move some of the eye care closer to home. So things like glaucoma being able to be managed much more locally for patients, so to avoid them having to travel into hospital settings for that. So lots of work going on outside of hospitals to try and improve and provide better services to our local communities. Next slide, please. That's just a map there to show you how our practices are clusters. You'll see it's been done by a geographic basis, but there is a real benefit to those practices working in collaboration and being able to develop services across their organisations, and being able to share staff and things like that is a real benefit for those practices. Next slide, please. I thought it also would just be useful to mention to you the work that we're doing around MyStake Hospital. As you'll know, as part of the boundary change, when we took over the Bridgend locality, we also took over the running of MyStake Hospital. Since we have taken over MyStake, we have done some improvement works around some of the sort of patient-facing areas, clinics, the lobby, doing some work on flooring and repainting. And during the COVID surge back in March, we increased our bed capacity there from 20 to 24 beds and implemented a new model where GPs take responsibility for overseeing the care of patients on the ward. However, as many of you will know, we had a significant outbreak of COVID-19 at MyStake Hospital. which resulted in 24 patients, the 24 patients all contracting COVID. It spread very quickly across the hospital, and unfortunately we had 11 patients who died during the outbreak of COVID at Maesteg Hospital, where they'd had a positive diagnosis of COVID-19 in the previous 28 days. So it was a really, really challenging time for us at that hospital. Nearly all of our staff also contracted COVID-19, so it posed us some significant challenges to manage that situation. What we did do was we moved the patients that were remaining, once it was safe to do so, we moved them to the field hospital in Bridgend, and we closed the ward on the 6th of November. Sorry, not closed the ward on the 6th of November. We closed the ward after we transferred those patients out to enable us to undertake significant planned maintenance and building work. We want to improve the facility at Maesteg Hospital. Part of the reason why the outbreak spread so quickly was we have limited capacity to isolate patients there, and the space really doesn't lend itself to modern day clinical care. So we want to make sure that we are able to improve the bed spacing, improve isolation facilities, and also do some other work on the facility where there's some significant problems in terms of the infrastructure there, the roof, some of the other infrastructure. A lot of work that needs to be done, which we'll be starting imminently, and aim to get the hospital reopened as quickly as possible in a refurbished state. Next slide, please. Also thought it'd just be useful to mention, Marcus mentioned it at the beginning, we have had some significant challenges in our maternity services in the past in the old Cwmtaf Health Board, but we've taken the opportunity now, we've also taken over maternity services at Princess of Wales Hospital, to look at how we can improve our maternity services across the piece, across the whole health board. So we have the Welsh Government commissioned an independent panel to oversee the improvement work in our maternity services, and they published their last report in September this year, which identified significant progress in our maternity services, and with 50 out of the 70 recommendations made by the independent reviewers now being implemented, and further work being done to improve culture and values, culture and clinical services across the maternity departments. We've got some really great work going on. We are not there yet. We know there's further work to do, but I'm really impressed by the commitment and the resolve from the maternity staff to make sure that we continue to develop and build our services for local families and the women who want to give birth in our area, to make sure that our services can be the best they can be. Next slide, please. So moving forward, our key priorities, obviously carrying on managing the COVID-19 pandemic is the immediate priority. We know there's a number of areas around the integration of Bridgend that are still not completely resolved. Technical things like IT issues and things which can often be quite the big bugbear for our staff when that is problematic for them. We want to work and are already in ongoing conversations with the Borough Council on further developments and opportunities around integration of health and social care. And I know our colleagues in our local integrated locality group in Bridgend really are starting already to look at how they can work with colleagues in the council and the local communities on population health and wider community engagement. And we want to continue to involve people like yourselves and other key stakeholders in the community in how we develop our services, not just in Bridgend, but across the whole of the Cwmtaf Morgannwg area. I think that's the last slide on my presentation. Just next slide. I think there isn't one. No, that's it, Mr. Mayor. Thank you very much, and obviously I'd welcome to any questions your colleagues may have.
Mr. Mayor, you're on mute.
Sorry, thank you. Yes, thank you for that. I stayed mute. Sorry for that. Yes, thank you, Paul, and thank you for that very interesting presentation, very informative indeed. I do in fact have 9 the councillors lined up for questioning, and I would ask them to be as brief as possible in view of the number that have those questions. The first councillor I call on is Councillor Ross Thomas, please.
Yeah, thank you. Thanks very much, Chair. Diolch, and thank you to our colleagues on the Health Board as well. Can I just quickly start by paying tribute to everybody that works in our NHS? I think it's fair to say while our communities and wider society around us limp from restriction to restriction and lockdown to lockdown, there's been one constant throughout all of this, and that's been our health service, and the same can indeed be said of the social care sector. The founding principles of the NHS, I think, have been brought under tremendous pressure in years gone by, but it's proven time and again its worth and its value, but above all else, the need to keep it free at the point of use, and where importantly, staff are remunerated accordingly. So a big thank you, diolch o galon, from me and the people of my stake for everybody that works in the NHS. Very quickly, Mr Mayor, as of yesterday, 2 of the 7 health boards in Wales had cancelled non-essential appointments and elective surgery, having been overwhelmed with the care of patients with coronavirus. Why is it that we haven't made better use, or indeed earlier use, of field hospitals where COVID patients can be treated in order to allow hospitals to better cope with ordinary everyday issues? And if you will, Mr Mayor, just secondly on communications, I understand that the senior exec team meet regularly with senior elected local politicians to share emerging themes in the spread of the virus. I spotted on social media a very useful and ad hoc update from independent board member Ian Wells, referring to hotspot areas, the reason for the spread in the virus locally. I'm just wondering whether any, I'm not wanting to add additional pressure obviously to workloads, whether top line updates of that variety can be shared with local elected members at this level, which can in turn, I think, really help with local messaging. I'm just wondering if that's a possibility. I think the local messaging, I think, is really key to shaping behaviours. Thank you very much, Mr Mayor.
Thank you, Councillor Thomas. Paul, do you want to come in on that?
Yeah. Yes, thank you, and thank you, Councillor, for the question. Just in terms of the field hospitals, we opened our field hospital, I think it was back in October now. In fact, we were one of the first, I think, if not the first health board in Wales to open the field hospital in the second peak. We took the decision to have patients in the field hospital who are recovering from COVID. So they're all patients who've had COVID and are recovering. The challenge of putting patients who we're not sure about if they have COVID or not in a field hospital setting is that we don't have the facilities to isolate people easily in the field hospital. We have a very, very small number of separate rooms, and so we felt it was it's better for us as a health board. We decided it was better for us to have that facility for recovering COVID, because we know that everyone there is recovering from COVID, has had the disease, and we can treat everybody as such. If the challenge we have in our acute hospitals, such as Princess of Wales, is when people arrive at the emergency department, we don't know if they have COVID when they arrive. So we have to do a test, and that takes time, and that's part of the complexity of managing the patients as they arrive through the front door. So we took the decision to have the field hospital treating recovering COVID patients. To your point about data, I'll have conversations with the colleagues at the council. The data we have, we try to share as widely as possible. If it would be helpful, I'm sure we can have a conversation with your council leader and chief executive about how we best disseminate further information at a locality level, so elected members have the most up-to-date data around their particular communities.
Thank you, Paul. Next on the list is Councillor Sedgbeer. Councillor Sedgbeer, please.
Thank you, Mr Mayor, and I'm sure we all want to echo Councillor Thomas's points about our thanks to all the NHS staff for your incredible hard work, and thank you, Paul, for your presentation and coming in at such a strange time as to the Health Board. My 2 questions relate to maternity services. Firstly, I'm concerned about the lack of antenatal classes for pregnant women and their partners through COVID, as they're currently non-existent. And I'm worried about how that will have a knock-on impact for our early years services, especially in the poorest of our communities. I do appreciate that pregnant women are in the extremely clinically vulnerable category, and there are different challenges that the Health Board has to work through when working with pregnant women. I'm just worried that they will be missing out on those key skills to prepare them for parenthood, and therefore it will have a knock-on impact later on down the line for us as a council. And then secondly, I wanted to raise the issue about breastfeeding rates in Cwmtath Morgannwg Health Board. According to the UNICEF 2010 report, the UK has an 81% record of breastfeeding at birth, but from data published by the Health Board, you have like a monthly data that's presented. It's around about 55% each month of babies that are born in the Health Board breastfeeding at birth. And we all know that those rates dramatically drop within the first 6 weeks. Again, I'm just wondering what can be done during COVID and after COVID to improve our breastfeeding rates in the Health Board, as we know that this has a significant impact on baby later in life and also has many positive benefits for mother as well. So those are my two questions, and I probably need to declare personal interest in those as well. Thank you.
Thank you, Councillor. So yes, you're absolutely right. One of the biggest challenges through COVID has been how we support the maternity services with their ability to carry on running certain clinics and services for expectant mothers and families. It's been really challenging. We have had to try and juggle the safety of our services with the ambitions and rightly the desires of the women and their families to have access to our services. There is some national guidance that's come out recently about things like attending scans and things like that, so we're obviously following that, and we are constantly reviewing our services. So on the particular point about antenatal, and clearly yes, we understand the impact of having to change these services and reduce them sometimes during COVID, and it can, as you say, there is a risk of an impact on early years. What I would say is we do have very good links between our maternity team and our health visiting teams. So where we have concerns or where we feel we need to be putting extra support, we will do that. But yes, it's a very challenging thing to have to manage. In terms of the breastfeeding rates, obviously, as you say, it's something we try to encourage. I know our midwives do a lot of work around this. We have a specific breastfeeding midwife whose aim is to try and encourage women to breastfeed their babies. I think there's probably further work we need to do on that. Some of this is also linked to how we educate and support our expectant mothers pre-birth to make sure that they understand the benefits. But it's an area we are very much focused on and want to improve. So we will continue to do that. And obviously, we would be happy if you wanted to hold us to our progress in future months. I'm sure we'd be very happy to get your thoughts on that. Thank you.
That would be great if I could. Thank you.
Right, thank you, Paul. Next question, please, Councillor Howells.
Thank you, Mr. Mayor. And Paul, can I also associate myself with the comments of Councillor Thomas and Councillor Sedgbeer about the great work you and your colleagues are doing in these difficult circumstances. I want to focus on looking forward, as you said, as Marcus said in the initial presentation. And obviously, during the current crisis, many health boards, most of them across Wales, have had a number of surgeons and medical staff redeployed, shielding or undertaking limited or no surgical activity during most of this period. And this may continue, it seems, until the foreseeable future. It's recognised that time out from professional practice impacts on skills and confidence. The impact of skill fade on the performance of doctors is a matter of interest to the General Medical Council because of its duty to protect the public by ensuring doctors meet the expected standards of good medical practice. What steps are you taking as a health board in conjunction with other health boards across Wales to ensure that those surgeons and other clinicians who have been out of doing their normal day-to-day job during this period, to ensure they're refreshing their skills and all that, so that they can protect doctors and health boards from litigation, ensuring the safety of patients and supporting doctors returning to full practice once the pandemic is over. Thank you.
Okay, Paul. You're muted, Paul.
Sorry. Thank you. Yes, you're absolutely right. One of the biggest challenges, as you say, is, as I mentioned in my presentation, is that we have a number of our services that have had to be stood down, particularly elective operating, and that's hugely frustrating for many of our surgeons and anaesthetists who obviously that's their job. They enjoy the work they do. They want to provide a good service for their patients. They're frustrated when they can't do that. As you rightly say, it also we need to make sure that we are also giving opportunities for our junior medical staff to who are in training to observe and be part of enough operations, because a key part of their training is doing that. So we are always looking for ways we can try and maintain our operating. We've juggled around our services. We have a number of surgeons who are operating still despite the pandemic. It may not be to the same level that we would like. We had an arrangement that was established through Welsh Government to be able to access private hospital facilities in the Vale Hospital, where we have been doing some operating, and our surgeons have been doing that with anaesthetists. And we're also talking to our surgeons. I had a meeting with our orthopaedic surgeons a couple of weeks ago to look at what we could be doing over the next 6 months to try and ensure we're using them as much as we can to carry on operating and maintaining some elective work despite the challenges. So it is absolutely an area we're aware of. We're very conscious of it, both in terms of for our own qualified surgeons, consultants, but also for our junior doctors in training. And our medical director and his team are constantly reviewing our approach to this and making sure that we're doing whatever we can to give our surgeons and their trainees the maximum amount of opportunity to continue their work.
Thank you.
Thank you, Paul. The next is Councillor Lynn Waters, please.
Thank you, Mr. Mayor. And again, I would like to echo my thanks to everything our NHS colleagues are doing. At a previous presentation to this council, I asked about how the transfer of Bridgend to Cwmtaf would impact on the Path Lab services, which are critical to all patients at Bridgend hospitals and local GP services. The previous chief executive acknowledged that this was going to be a very difficult service to unwind and could take up to 12 to 18 months to unwind from Swansea. I'm fully aware that all of the expertise that used to be at the Princess of Wales was stripped out of there and transferred to Swansea on the previous reorganisation. So really just wanted to understand whether that has been progressed at all, or whether this is something that because of COVID hasn't been able to be moved forward. Thank you.
Thank you, Councillor. I'm going to ask my colleague Alan Laurie. He may come in on this question. I'm going to confess, after my 3 months, I'm not completely up to speed on that topic. So I don't know, Alan, if you're available just to come in on that point, just to answer the councillor's question.
Yes, thank you, Paul. You're absolutely right. When we did the boundary change, Path services had to remain within Swansea Bay as a result of the complexity. We have not progressed that as far as we would want to, and I think the COVID has got in the way of some of those conversations and discussions. It's still absolutely our desire to do that, to run it as one CTM pathology service. Some additional services have been put back into POW, so there is now a hot lab that has been established as part of COVID to undertake COVID-19 testing. We took over the mortuary, so we are running that because that was in a perilous state at the point in time of transfer. But the other services to move across are taking longer than we would like, and it's certainly on the top of the list when we get beyond the difficult period we've got now to unwind those from Swansea Bay. And in fairness, colleagues in Swansea Bay wanted to do that. So that we've got a joined up service across the whole of CTM. So your point is absolutely very well made, and we have not made the progress we would have wanted to, but I think COVID has not helped us in relation to be able to move that forward.
Thank you, Alan. The next question, please, from Councillor Dendy.
Thank you, Mr. Mayor. It's just looking really talking about the community with healthcare and about bringing that services closer to the community. One of the things on there as well was like local health to reduce inequality. One of the major problems I have that is definitely in my community is access to pain care management. although there are a lot of alternative therapies out there to help with pain and also clinics and stuff, they're not accessible easily by public transport. Plus, if you are somebody who is suffering from pain, swapping over buses and spending a couple of hours out your day getting back and forward probably undo any good work going on there. So I was just wondering if pain management coming to communities is also a possibility, as well as diabetic, mental health, etc. Thank you.
Yes, I mean, obviously, as you say, pain management is a very debilitating disease that people suffer with, and as you say, also, we need to make it as easy as possible for people to access those services. You're very right to raise the point about transport, and certainly that's been an issue that's been raised with me a number of times by local GPs who make the point that many of their patients aren't able to access transport easily to get to clinics in Bridgend at the Princess of Wales. So we really do want to look at both how we move more services out of hospitals into communities, and pain would be very much one of those sorts of services that we would look to transfer out, but also where it's not possible to move the service out. I do think there's a question for us as a health board about whether, in particular in areas where public transport is not good, looking at whether we should be thinking about working with a voluntary sector organisation or a third sector organisation to look at transport arrangements to see whether we could provide transport services to bring people to a particular service. So it's absolutely something we're focused on. We're very aware that transport access is one of the inequalities that we have to manage, not just in Bridgend but across our whole patch, and the pain service, as you say, we would be hoping that we would be able to move elements of that out as into community as much as possible.
Thank you, Paul. Next, Councillor Tim Thomas, please.
Yeah, thank you, Mr. Mayor, and thank you, Paul, for your presentation. I also pay tribute to the hard work of all NHS staff. It's a pity that Professor Longley had to leave. During the start of the formation of Cwmtab, we had a very productive meeting over the shortfall in primary care services, particularly GP surgeries and dental surgeries in the Valleys Gateway area. Just for your reference, Paul, the Valleys Gateway area is a cluster of wards just off the Junction 36, which has had some quite rapid house building undergone recently. During that very productive meeting with Professor Longley, it was agreed that greater provision in primary care was needed. We also explored some other models, such as linking health and social care and building centre of excellences as well. Now, the main way to move this forward was a series of consultation. I take the point that COVID would have obviously have changed priorities, but I just wondered if you had any renewed timescales for consultation on whether we have adequate primary care services in Bridgend, with particular reference to the Valleys Gateway area.
Yes, we are doing a lot of work on that at the moment. And again, I'm going to bring Alan here because he knows a lot about primary care services in our patch. So Alan, if that's an area you could come in and just answer the councillor's question.
Yes, and I do remember the discussions that took place about that, and you're right, it's a pity that we haven't been able to sort of progress those in terms of further consultations. We are very aware of the house building across the whole of the M4 corridor, and you'll reflect back in one of Paul's slides, we talked about the Pencoed Llanharan area. Very recognise that that's not just in Pencoed Llanharan, it goes further than that. We have been having conversations with the general practice in North Kennelly, and we want to pursue with them. We're trying to support them in relation to new facilities there, but I think it's wider than that, and I think the health and social care dynamic, i.e. a health and wellbeing centre, rather than just a purely a new general practice or a additional general practice is what's required. So I'd be very keen that we pick up some consultation around what should that look like in the whole of that area, not just in one particular practice. And I'll get my primary care team working on that, if that's okay, Councillor.
Yeah, excellent. Thank you. Look forward to hearing that.
Thank you, Alan. The next question is from Councillor Baldwin, please.
Thank you, Mr. Mayor. You'll probably be pleased, Paul, this isn't a COVID question, and it isn't really a health question. The housing and health is very closely linked. And what can health do to release land assets at below market value to improve and increase the levels of affordable housing that will ultimately meet the health agenda? Housing is pivotal to good health. We've seen in the past the top slicing of ONLUS funding for the building of extra care schemes, and we already know the social housing grant allocation from Welsh Government to local authorities is decreasing. So what could health do, and what could you put in place to facilitate that release of land, and helping us as a local authority use the language that meets your agenda and understanding, so that we aren't talking two different languages?
Yes, thank you, Councillor. You're absolutely right. I mean, I think there's a lot of evidence about the link between good health and good housing, and so obviously we've got very much a vested interest to make sure that we do whatever we can do as a large landowner in the Cyntaf Morgannwg area. As we develop our estate and our service models, our buildings that we currently have and some of our facilities are clearly not going to be fit for purpose. So part of the conversations we've had, and indeed we've had some conversations in other part with the RCT Council about looking at some of our facilities and thinking, could we free up some space on our land to support extra care housing development or particular housing that is of a particular need for local communities. So it's definitely something I would be very keen to talk to colleagues in the council about. I think it's about having for us a clear idea about where our clinical services need to be in the future, therefore what's our building need going to look like, and therefore what does that mean for our sites, and where we have sites or parcels of land that may be perhaps surplus to our requirements as a health board, having the conversation with yourselves as a council to say, would there be a need locally with you that you would know about with housing colleagues to think about an opportunity to develop those. So I think it's about that ongoing relationship and conversation with you at a local level, and making sure that we're not missing any opportunities to sort of think creatively about working together to develop new and innovative models that would bring housing and health closer together.
Alan, did you want to come in there? You've switched your camera on.
Yeah, just to say, I think the addition of housing colleagues around the Regional Partnership Board is really helpful in that, guys. I think a lot of our concentration around the RPB has probably been around adult services, to some extent children's services, but we really haven't talked about housing and where housing and housing associations fit with that. So myself and the Director of Planning recently had a conversation with a number of colleagues in the housing association field about the interesting opportunities that they have and available to them through their routes, which we don't normally think about. So it does feel as though a conversation on a three counties basis around how we better work with housing associations, and we use the auspices of the RPB, bringing that together in an umbrella way, is a good way. Would it be a good way for that? So we can do things once, learn once, and where we've got some good practice in one area, we're replicating it somewhere else. And I know that housing association colleagues will be keen to work with us on that.
Thank you, Alan. Move on then to the next question. That's from Councillor Smith, please.
Thank you, Mr. Mayor, and thank you, Paul, for noticing and noting Bridgend's efforts in integrating social care and health. It was something I was very pleased to see a few years back when I was having adult social care as part of my portfolio. One area where further integration is needed is to do with the treatment for elderly people with dementia. We've had experience of this in my family, and quite recently my son and his partner have had the upsetting experience of having to prepare a house for sale to look after one of my grandchildren's other grandparents suffering from dementia. I was very moved this morning to hear on radio a very eloquent plea from the widow and son of Mr. Nobby Stiles. I'm one of the few councillors old enough to have seen Mr. Stiles on black and white television at the very moment in July 1966 when he became a national mascot, and Mrs. Stiles and son were very eloquent with regard to how the NHS treats people with dementia, and explained that the NHS regards dementia as a condition, not an illness. My perception is it's not really much better in Wales than it is in England. And in those days, footballers weren't automatic millionaires, and Mr. Stiles had to sell his medal, I believe, and his house for treatment. Now, I know you're not a policy maker, but you are an influencer, I hope. So I'd like some indication of what your thoughts are on this much needed aspect of further integration, Paul.
Yeah, absolutely, Councillor. And I think, you know, the dementia has become over recent years a significant illness that we are becoming much more aware of. I think as a society, and certainly as health services, we are very aware of it. If I mentioned the field hospital earlier on, many of the patients that we have recovering from COVID, for example, will have dementia, and we've worked very closely with social care and also voluntary sector organisations to make sure we get support into the field hospital to support them whilst they're a patient, because we know that for people with dementia, coming into hospital is a hugely upsetting and disconcerting experience. So we've got to do whatever we can do to support those people when they come into hospital, but also to make sure that we work very closely with our colleagues in social care, that when we're transferring a patient back home again or to a care home for long-term care, that is done in the most sensitive way, and not just for the patient but also for their families, because we understand absolutely it's a very distressing time for patients' families as well. I think there's always more we can do, and I know our colleagues in our mental health services are working very closely with our general adult services, because I feel very strongly that, you know, we shouldn't compartmentalise dementia as a mental health issue. It is a mental health problem, but it absolutely is integral with people's physical health as well, and we need to be making sure that all of our staff across our services understand the particular needs of people with dementia, whether that's in a specific older people's mental health service, or indeed whether it's a general clinic where a patient with dementia may be coming in for an ophthalmology appointment or a blood test or something like that. It's really important that we have an understanding of the needs of people with dementia across our whole service. So it is an area of focus for us. I know our colleagues in mental health are very much working on this agenda. And I think it's another example of where we can't do this ourselves. As you say, this is an area where we absolutely need to work jointly with social care, voluntary services. There's some great community support groups out there for families and patients with dementia. We need to be working alongside those to make sure that our service can be the best it can be, and that we also support people through this very difficult disease and as they're dealing with it.
Thank you, Paul. Claire Marchant, Social Services, indicated she wishes to contribute to this. So Claire, would you like to come in on this?
Yeah, thanks very much, Chair. Just very briefly, a positive development that we've had through the Transformation Fund is that we now have CPNs, community psychiatric nurses, as part of our integrated network teams, and that's just in the last number of months that development has happened, and that really reflects what Paul has just said and said in the presentation about the importance of that cluster work and the importance of the team around Mrs. Jones, and the importance of physical and mental health services working together. So that's something which has just occurred, and I had the privilege of sitting in on a multidisciplinary team where somebody with dementia was being discussed, and it was the CPN who was really leading that discussion and obviously already making a key contribution in terms of that integrated working. So services are developing in a more integrated way, and when we agree our next phase of priorities with the integrated locality and the health board, dementia services will be there as one of those top priorities.
Thank you very much, Claire. Okay, last question then from Councillor Webster, please.
Thank you very much, Mr. Mayor. Thank you very much for the presentation, Paul. It was very pleasing to hear that health and social care integration was mentioned twice. And it's strange, as I was talking about that yesterday with a colleague in Bridgend. So to hear it twice mentioned goes to show how important it is on your agenda with regard to delivering direct payments and to getting that to the person that needs it fast. I've long mentioned the unholy trinity that I have experienced with regard to health, social care and education. It doesn't join, so to hear you talking about it joining and to hear you talking about it working well is really positive. It is with that in mind that I want to ask my question about the Armed Forces Covenant. Now, we're seeing more military families come out of living from behind the wire and moving across the country. So what communication, what conversations are you going to have, if you're having them and if it's happening, about transferring those direct payments that go with the families as they move around the country, please?
Thank you. Alan, you're muted again. Alan, you're muted. There we go.
Oh, me. Sorry. Thank you, Councillor. Yes. So, absolutely, military families are a very important part, and we need to make sure that we recognise the particular circumstances that they have to deal with. Moving around the country and having to move between services is always a bit of a challenge for people. I'm not sure, if I'm honest, about how the process of direct payments work through. That's clearly is a social care responsibility in terms of the management of the direct payment. But I would say on the health side, we have a very clear guidance around our obligations around supporting military families, the Armed Forces Covenant, as you mentioned. We want to work very closely with the military and indeed any veterans of the military who may choose to stay in the local area to make sure that their services are as good as they can be. I don't know, as I said, about the particular point about direct payments, I don't know whether Claire from Social Services may want to comment on that, but
sorry, can I chip in?
Sorry.
It is part of the health, the payments that come from health to support some families, which do move around, which is the health element which I'm talking about.
Oh, so the continuing care. It may be the continuing care. Oh, sorry. Yeah, sorry. I got stuck on
Okay, Paul.
on the language.
Paul, I've had
so continuing care.
Yeah, I've had Claire come in.
Okay.
She says she can make a comment. Claire, would you like to come in?
Thanks very much. Certainly in terms of where people move between Welsh authorities under the Social Services and Wellbeing Act, assessments and care plans are transferable between Welsh authorities. It can be a little bit more challenging when people are moving into England, which clearly some of our armed services families will be. And we do look to work very closely with transferring authorities if that is indeed the case. We try to take a very person-centred approach with our health colleagues. So as Paul has said, that there will be differences in terms of direct payments, and where we've got joint arrangements with individuals and with families, where we can be flexible and support that element as a local authority through a direct payment and take the lead on that because of restrictions on health services. We will always look to do that in the most person-centred way.
Thank you, Claire.
And just to finish off on that, the continuing care element of somebody's care, so the NHS funded part, we would also work very closely with colleagues in the other health boards. Our continuing healthcare team would work with their opposite numbers in the other health board, and indeed continuing care is a policy also in England, so they would work also with English health authorities on transferring that funding appropriately.
Thank you very much for that. If I can reach out to Paul and Claire about some issues which I am actually seeing, then perhaps you could look to improve the service for our residents. Then thank you very much.
Yeah, thank you, Councillor. Thank you, Paul. Thank you, Alan. And I know he's gone now, but to thank Marcus for what has been a very informative and very broad presentation. And we're very grateful to you, and I'm sorry about all the questions, but they were obviously very important to everybody, and so they must be. And thank you for giving such fulsome and informative answers. I'm sure we've all benefited greatly from your presentation. So thank you very much for coming along and presenting it to us. Thank you both very much.
Thank you very much, Mr. Mayor. Thank you. Goodbye.
Goodbye. Members, now the recommendation is that we accept the members note the presentation of the Chief Executive and Chairperson of Cwm Taf Morgannwg. So can I have a mover for that, please?
Move.
And seconded?
Second.
Thank you. And that members note the programme of presentations being delivered by the Council's partners in 2021. Can I have a mover for that, please?
Move.
And seconded?
Second.
Thank you very much. Okay, we're moving on to item number 7 now, review of political balance. Kelly Watson, please.
Thank you, Mr. Mayor. For the purposes of the recording, I'm Kelly Watson, Monitoring Officer for the Authority. Members, the purpose of this report today is to advise Council of the outcome of a review of the political balance for the Authority, to seek approval for that revised political balance, to receive a nomination from the Independent Alliance Group to sit on the Town and Community Council Forum, and to note that Councillor Tim Thomas will no longer sit on the Appointments Committee, as this was a role undertaken in his role as Group Leader of Plaid Cymru and will now be undertaken by Councillor Malcolm James. Members will recall that on the 30th of September 2020 at the annual meeting, you approved the political balance and made appointments to committees to reflect the political makeup of the authority at that time. Subsequently, there have been changes to the membership of the political groups. Councillor Tim Thomas has left the Plaid Cymru group and has joined the Independence Alliance group. Councillor Ros Sturman has left the Plaid Cymru group and will sit as a standalone independent member. Councillor Malcolm James is now the leader of the Plaid Cymru group. Councillor Julia Williams will no longer sit as a standalone independent member and has joined the Independent Alliance group. Councillor Sean Aspey has left the Independent Alliance group and will now sit as a standalone member. At 4.1 of the report, you can see the current political composition of the council, which shows the percentage of seats and the number of seats that are then allocated to committees. Following this review, the membership of the committees has been updated, and members can find this at Appendix 1 of the report. In summary, the changes are that for Labour there is no change, for the Conservatives there is no change. The Independent Alliance will gain a seat from Plaid Cymru on the Town and Community Forum. Councillor Julia Williams and Councillor Tim Thomas will maintain their seats held on committees, with the exception of the seat held by Councillor Tim Thomas on the Appointments Committee. And Councillor Malcolm James, as leader of the Plaid Cymru, will now take the seat on the Appointments Committee. Llanelli Independence, there's no change. Unless there are any questions, members, I take you to the recommendations of paragraph 9, and in particular, we need to receive the nomination from the Independence Alliance Group for the Town and Community Council Forum. Thank you.
Thank you, Kelly. Do we have a nomination? Oh, who's that? Oh, Councillor Clark, are you trying to come in on this?
I am, Mr. Mayor.
Yes, you're getting feedback. You're screeching.
Yeah. Just a minute.
Okay.
Sorry. We're too close together.
Yes, yes.
I'd like to propose Councillor Amanda Williams.
Okay, you're proposing Councillor Amanda Williams for the nomination to sit on the Town and Community Council Forum, is that correct?
Muted, Mr. Mayor.
Sorry. No, I'm not. No, can you hear me, anybody?
I can't hear anything now.
Yes, we can hear you.
Yes, I am being heard, Councillor Clark.
I don't know what you're doing. I think you're messing me about.
No, we can hear you, Councillor Clark. I'll take it that you've nominated Councillor Amanda Williams, and we'll accept that nomination.
Sorry, Mr. Mayor. Yes, I'd like to propose Councillor Amanda Williams. Sorry.
Yes, okay. Thank you. Is that accepted? Everybody?
Yes, I'll second, Mr. Mayor.
Thank you. All agreement? Okay. Right, Councillor Amanda Williams then is now the representative of the Town and Community Council Forum for the Independent Alliance Group. Can I have the recommendations in their entirety moved, please?
I'll move that, Mr. Mayor.
Aye. And seconded?
Second.
Thank you very much. Item number 8, information reports for noting. Kelly, please.
Thank you, Mr. Mayor. Just a very brief report to inform Council of the information reports that have been published since your last meeting. You'll see at paragraph 4.1 there has only been one, and that was in relation to an urgent delegated decision. The decision related to the modification of the contract in relation to Maesteg Town Hall. I'd ask members to note the publication of that report. Thank you.
Can I have a mover for that, please?
Move.
Seconded?
Second.
All in favour? I'll take the silence as yes. Okay, then we now move on to item number 9, which is the motion from Councillor Giffard. Councillor Giffard, are you there?
Hello.
Yes, can you hear me, Councillor Gifford?
Yeah, can you hear me okay?
Yes, I can.
Brilliant. Are you happy for me to present the motion?
Yes, if you would, please.
Brilliant. Well, thank you, Mr. Mayor, for the opportunity to present the motion to full council then today, which is submitted in my name. And whilst today is seconded by Councillor Pacella, it was initially seconded by Councillor John Spanswick, who I know would have liked to have been here today to speak in favour of the motion. So we all know how important green spaces are in our communities right across the county borough, particularly as over the last few months, our residents have been using these areas more than ever as they spend more time at home as a result of the ongoing pandemic. So I've heard stories from residents in my ward of Brackler of people valuing open green space, not only for their physical health and well-being, but also their mental health too. Some have even said that they're not sure how they could have mentally coped with life's problems, particularly at the moment, without readily accessible green space in their local area. There are many other reasons why green space is important, and there are too many of them for me to go into today, but I would hope that every member would agree that the loss of any green space should be considered an absolute last priority. And so today's motion is about shifting the focus of our planning strategy to reflect that, as well as better aligning ourselves with the Welsh Government Future Generations Act to safeguard these spaces for the future of our communities right across the borough. So the purpose of today's motion is very, very clear. It's to put power back in the hands of local people across our borough when it comes to real life planning decisions in their communities. I think if you spoke to any individual in your ward or a set of individuals in your ward and asked them exactly how much influence they think they personally have over the council's planning decisions, I think the overwhelming response would be very little. Today we have an opportunity to change that. So the motion today calls on the council to protect future open spaces and woodlands, to sign the Wales Placemaking Charter, and in my view, most crucially, to reflect the fact that a loss of green space should be a last priority. The motion seeks to hold a confirmatory referendum to check if people really do want to lose green space in their community and put the power back in the hands of local people. I'm sure no member would want their communities at the forefront of these decisions, would not want their communities at the forefront of these decisions in their area. So I would ask members to consider this motion and back this proposal in full today.
Thank you, Councillor Gifford. Do I have a seconder for the motion, please?
Second.
Second by Will. Yeah. Who was seconding it? I couldn't get the voice.
Councillor Sturman.
Thank you, Councillor Sturman. Now, Councillor Sturman, do you wish to speak now or reserve your comments until later in the debate?
If I could speak now, I would just like to broadly support this motion. I think it's a really good move. The only thing I would like to say is that in paragraphs 1.1, 1.3 and 1.5, I would like it to actually say Bridgend Borough Council, because it just says Bridgend, and that could actually just mean town-centric. And you know, we've got a lot of green spaces elsewhere within. The other thing I would like to say is at the bottom, the very last item, should the loss of green space be the only option for any council, including any council building project, that a local referendum be held within the council ward where the work is due to be located to determine the community's support for such a project. Now, I feel that doesn't actually go quite far enough, because you could have a referendum and then nothing would be done. I would like to add that would then become a material planning consideration when any decisions are made. Thank you.
Councillor Sturman, are you moving these as amendments?
Yes, thank you.
Okay, I think we all heard that as an amendment to the motion, and that needs to be seconded.
Mr. Mayor, if I can come in first, I think firstly we need to see if we've got a seconder for the actual motion as it's drafted, and I understand Councillor Pacella was going to second the motion as drafted.
Have we a seconder for the motion as drafted, please?
It's already been signed, Mr. Mayor.
Yeah. Yes, Mr. Mayor.
I'm happy to do that.
Okay, it's been seconded then, Kelly.
Okay, if we can have, does Councillor Pacella, as the seconder for the actual motion,
yes.
He has the opportunity now to say whether he wants to say anything in support.
Right, Councillor Pacella, do you wish to say anything?
Yes, thank you, Mr. Mayor. In support of item number 3.3, I would like it to remain as is, please.
Yes, but what about the rest of the motion? You're still supporting it?
Yes.
Thank you. Okay, do we get back to...
What we have now is we've got the amendment as proposed by Councillor Sturman. In relation to the referendum issue, what I would like to say to all members, and this is in relation to the substantive motion and the proposed amendment, is that any such proposal that will form part of this planning would be subject to statutory public consultation. It would mean that there would have to be a consultation process with the public before a final decision is taken. And what members need to consider before they accept the substantive motion or the amendment is whether that is an appropriate use of public money to hold a referendum on the same issue that would be subject to a public consultation. Obviously, that is a matter for members, but you would be asking the public the same question twice. One would be a non-binding result, and one would be have to take it into consideration as part of a statutory process.
Okay, thank you.
Bearing that in mind, Mr Mayor, we now need to see if there's a seconder for Councillor Sturman's amendment.
Yes, I did ask. I don't know. There were several.
Can I come back in really quickly on Councillor Sturman's amendment? I'm very happy to accept the first part, the references to Bridgend and Bridgend County Borough. We're only there for the sake of brevity. The intention is to reference the borough throughout. On the second part, I wouldn't support that simply because of the discussions I've had with the monitoring officer and planning officers and others. In terms of the binding nature of the referendum, I totally accept what Councillor Sturman says. However, I think it would be a very brave council that would go against a negative referendum result, whether it was binding or not. So I'm very happy to accept the first amendment, but not the second one.
Thank you.
So, Kelly, does that have to be a formal amendment just for the naming of the county?
For the name, and I don't think that would need to be a formal amendment. It is just.
I'm sorry, Kelly. Sorry, Mr. Mayor. A point of order has been raised in the conversation box, and that should be taken immediately before any other discussion happens. Sorry to interrupt so abruptly.
Yes, sorry. Yes, I'd only just seen that. Councillor Gebbie, you have a point of order.
Thank you very much, Mr. Mayor. Surely to goodness, we are not supposed to be debating a motion that has not been seconded in the first instance. It just seems to be all backwards.
It has been seconded. It has been seconded.
I beg your pardon, Chair, but you've allowed various discussions from various people, even the person that raised the motion in the first place. And I'm really concerned that we're discussing planning issues, which would be against anybody speaking here. People that sit on the planning committee, why are they predetermining already?
Councillor Gebbie, I haven't identified a point of order. The motion was seconded by Councillor Patella.
Mr. Mayor, may I come in?
Yes, who's that? Anil?
It's Councillor Richard Young.
Richard Young, yes, Richard.
Mr. Mayor, I don't know if I'm going to be helpful or not, but I'd like to take some advice on this. The amendment is calling for us to treat a referendum as a material planning condition. I don't think that we can do that, because I think that would have to be a change of planning law. Now, on that basis, I don't think the amendment is a right and proper amendment. On that basis, I think we ought to take some advice from the planning officer.
No, Mr. Mayor, if I can just come in for a minute. At the moment, the amendment hasn't been seconded. So before we start any debate on the amendment, do we have a seconder?
Do we have a seconder for Councillor Sturman's amendment to paragraph 3.3?
I think Councillor Thomas has seconded it in the conversation box.
Okay. On the basis that that amendment has now been moved and seconded, I do need to point out that we can't bind the hands of the planning committee. So that amendment, in my view, it wouldn't be a lawful amendment that this council can make here at this time. But obviously it is a matter for full council. So I think what we need to do now is ask full council whether they agree with that amended motion or not.
So members, do we agree with that amended motion or not? And we need to take a vote on that, please. So,
I mean, we can see if, I know it's difficult remotely, whether we need to do a roll call and go through the names, or whether we can just get a...
Well, we need to take a vote on that amendment, don't we? That's the next move.
Mr. Mayor, can I just say I'll move Kelly's proposal that she does a roll call.
Right, thank you.
Okay, so I'll pass you over to a Democratic Services officer now, who'll call out your names, and you need to say at this point whether you accept the amendment, and you're not voting for the original, you're just saying whether you accept the amendment as proposed by Ros Sturman. You will be doing this on the basis that I am telling you it would be unlawful to bind the hands of the planning authority.
Mr. Mayor, I've asked to speak, please.
Yes, hold on a second. So can we in fact vote on a matter that you're saying is not legal?
It would be, it's not illegal, it would be unlawful for full council to bind the hands of the planning committee. So any decision made thereafter would be could be subject to judicial challenge.
Okay. I'm being inundated with people who wish to speak, and it's getting very difficult to see who's next. But
I think perhaps what we need to do, Mr. Mayor, is ask Councillor Sturman, in light of the advice I've just given, whether she still wants to propose that amendment.
Okay, Councillor Sturman, did you hear that?
I did, and I have just typed my reply. Oh, which said I withdraw that amendment, but it doesn't seem to have come up.
No, it hasn't come up on my list.
Right, no, my apologies. I withdraw that amendment. I would, however, still like it referred to as Bridgend County Borough, but hey ho.
Well, yes, I think we've accepted that as a,
thank you.
Yeah. So we're back to the original motion. So if there's anybody who wishes to speak now on the original motion, can they indicate now, please?
Mr. Mayor, can you hear me? Mr. Mayor, it's Councillor Clark.
Yes, I can.
A few of us, I don't know how many, we haven't got a send facility for the chat box.
Oh, I see.
Quite a number. I haven't. I don't think Councillor Brian Jones, Councillor Cheryl Green, it's quite a number. We just can't send a message in the chat box.
Yeah.
Okay, well, I will take those that I am receiving, and I'm going to take Councillor Amanda Williams first. She, I know, has indicated previously. Councillor Amanda Williams, please.
Hi, can you hear me okay?
Yes, thank you.
Great, thanks. I'm just putting my video on as well. I just wanted to say that I support the motion. During lockdown, I found the green spaces so valuable, and I didn't appreciate how many residents use and rely on these green spaces for activity. I appreciate, and I can see where the argument is coming from with regards to the amendment and everything, because I can appreciate as well there will be occasions where we might have to look at putting buildings onto green spaces. However, as long as we've got this consultation process, I think that we should be protected, because I'm hoping it would only be in absolutely necessary circumstances. And I do have support for the people in Brackler. I know this has stemmed from there, because one of the green spaces that they are up in arms about is one that is well used by the public, and I think we should be protecting these well used spaces. That's all I have to say. Thanks.
Thank you, Councillor Williams. Councillor Nora Clark, did you want to come in now?
No, I didn't want to speak, Mr. Mayor. I just wanted you to make you aware that we can't send, you know, if there's a vote, we're not going to be able to put anything in the chat box.
Okay, thank you. So I had indicated earlier, the Councillor Alex Williams, did you want to come in now?
Thanks, Mr. Mayor. No, it's fine now. I was just going to suggest the same thing as Councillor Baldwin and Councillor Pennell-Thomas, in that perhaps Councillor Sturman would like to withdraw the amendment, but that's now passed.
Thank you very much. Okay, does anybody else wish to speak on the motion, please?
I have indicated, Mr. Mayor, and as Cabinet Member, I would like to speak.
Okay, yeah, you're moving up. You're nearly at the top of the list. Okay, Richard, thank you. Please speak.
Thank you, Mr. Mayor. As Cabinet Member, I am concerned about this actual motion, and I think that we need to revisit the whole text of this. And I'm going to start at the top, and I make no apologies for this, because I think it's an important thing to do. It starts with the words "this council believes that" and continues with "woodland and open green spaces play a vital role in our physical, mental and emotional well-being, as well as being an integral part of Bridgend's biodiversity. The COVID-19 pandemic and the nature of local and national lockdowns has increased the need for open and accessible outdoor recreational spaces, and that these are essential for building cohesive and healthy communities, which ensures the well-being of future generations. Local government has both a duty and a moral responsibility to limit ecological damage and negative impacts on local biodiversity. Mr. Mayor, it goes on, but I would like to thank the author of the motion to the fact that this council already believes that everything that is contained in this part of the motion is in fact integral to the way the council works. It is an integral belief of this council. If you look at the next section, it goes on to say that council acknowledges that, and the first part is a review that is being held of the outdoor sports children's playing space audit as part of the emergency replacement LDP, ensuring the typology of open space and categorisations outlined in the Welsh Government's Technical Advice Note 16. Sport, recreation and open space are followed, with particular attention to differentiating outdoor natural green space and amenity green space. Well, I'd be surprised if we didn't acknowledge that, Mr. Mayor, because it is our review. Of course we have to review that, and it is already under review and ongoing. It mentions, Mr. Mayor, the Wellbeing of Future Generations Wales Act 2015, and that calls on Bridgend County Borough Council to improve the economic, social, environmental and cultural well-being of Bridgend, contribute to creating a nation which maintains and enhances a biodiversity natural environment with healthy, functioning ecosystems that support social, economic and ecological resilience and the capacity to adapt change. Contribute to creating a society in which people's physical and mental well-being is maximised and in which choices and behaviours that benefit future health are understood. Mr. Mayor, that is already embedded in our planning system. It is already integral. It is the law of Wales and we have to comply with it. So on that basis, that is already being enacted. The author goes on to mention the Bridgend Public Services Board's Wellbeing Plan, of which Bridgend County Borough Council is a significant member. It requires the council to ensure communities place a greater value on the environment and more people get involved in local issues, recognise the importance of green space in well-being and as a prevention factor. That is also part of the Future Generations Act, Mr. Mayor, and as I've already said, is being taken into consideration during planning decisions. Promote healthy, active people in resilient communities, volunteering, keeping young people in local areas, reducing travel to work, increased use and awareness of green space. Mr. Mayor, I think our strategy 2030 is well published, and I think that our active travel programme within this is actually one of the best in Wales. So we are, in actual fact, addressing this very issue. Work together to maximise benefit from cultural, built natural assets. Mr. Mayor, again, we are already doing this. Preserve and protect habitats, promote sustainable management of green spaces. In every planning decision that is made, we have, every important planning decision anyway, we have the environmental impact assessment. All this is contained within our planning process. So if we look at this, we are actually doing what is being outlined here. And I'd like to thank the mover for actually pointing out that we're already doing it. It mentions the Placemaking Wales Charter, of which the Welsh Government is a signatory, calls on councils and organisations to ensure following principles are met when planning, designing or managing new and existing places. The local community are involved in the development of proposals. The needs, aspirations, health and well-being of all people are considered at the outset. Proposals.
Councillor Young, can I ask you to move it along, please?
You can ask me, Mr. Mayor, but I will point out that I am speaking as the cabinet member, and as this is the context of the actual motion, I need to speak to it. So if you don't mind, Mr. Mayor, I do intend to carry on. I will make it as brief as I possibly can.
Please, if you would, Councillor.
When we are looking at the placemaking of Wales Charter, I would have no problem in signing this. I'm quite happy to sign it. We already do it, in actual fact. The planning process has a consultation stage where the public are consulted before any decision is made. On that basis, we comply. I have no problem with it, and I do not believe that our officers would have any problem with it. Failure to embed the objectives and goals of the well-being of future generations, Wales Act and the Bridgend Wellbeing, we cannot fall foul of the Wellbeing Act, and indeed we wouldn't be allowed to, and our planning decisions actually reflect that. So we come to the motion. Therefore, this council resolves to become a signatory of the Making Wales Charter, not a problem. Work to protect green open space and woodland within new and existing communities, not a problem. We are doing that anyway. And here's the crux. Should the loss of green space be the only option for any council building project, that a local referendum be held? Within the planning process, as I've said, we have a consultation period. It is a legal process, it's a legal requirement. It is direct interaction with the public. So I would consider that to be better than a referendum. In fact, I would ask the question to the author, having looked at the context behind the motion, I want him to tell me what part of this motion are we not already complying with, given the fact that there is consultation before decisions are taken. It is a legal requirement. I would ask him, secondly, that being the case, what is the relevance of a referendum? What would be its legal standing? Within the planning process, what standing would it have in there? If it doesn't have any standing in either the legal process or the planning process, then I would suggest that it is a diversion of limited resources for no discernible benefit. What is the basis of the motion? What is the purpose of the motion when everything within the motion is already catered for? Thank you, Mr. Mayor.
Thank you, Councillor. I have, before we ask the proposer of the motion to come back on that, I have two other speakers who've indicated. The first is Councillor Bridie Sedgbeer.
Thank you, Mr. Mayor. And I'll be brief because Councillor Young has also partly asked my question. I was just concerned that if the amendment was ruled that it would be illegal because we'd be possibly binding the hands of the planning committee, I'm still concerned about how the motion reads currently, that again it would possibly bind the hands of a planning committee and they'll be predetermined. So I just wanted to know where we stood on that, and also would it possibly, as Councillor Young mentioned, contradict the legal aspects of the planning committee that we have to go through in terms of the consultation? It mentions the fact that we have to do a referendum in the ward, but that often means that in the consultation, houses or residents who aren't in the ward but are actually nearer because of the geography of how things work, would they not get a say? I just think we have a planning law and process that we have to follow, and this seems to be trying to supersede, and I would be worried that we would get into legal difficulties as it is written right now.
Yes, thank you, Councillor. Before I ask Kelly to come in and comment on that. I have Councillor David White wishes to speak.
Cheers, Chair. I'd just like to take you back a few years. We had 5 green spaces in my ward, and what they wanted to do, they wanted to build houses on them. Now, I totally agree with the sentiments of the motion, and everything that was said in the motion is what we use as arguments to defeat the proposals. And the builders, the stakeholders who wanted to build on these 5 pieces of green spaces appealed to the Welsh Planning Officer, and he turned it down. So therefore, I'd like to ask, what can our motion do to enhance what we did 5 years ago, where we managed to stop 5 green spaces being built on in Newcastle Ward, with myself and those in the community. We used sound arguments we put through about health, about mindfulness, the need for green spaces, a cultural history of everything, by using sound arguments. Now, it's my understanding, I don't sit on planning, I'm not an expert, but I understand since then there has been efforts to make the planning system more robust in favour of keeping green spaces. I'd like to ask the planning officer if he's present if that's correct.
Yes, thank you, Councillor. Well, I'll ask Kelly to come in first on Councillor Sedgbeer's point, please.
Thank you, Mr. Mayor. Yes, Councillor Sedgbeer, you're correct. That a local referendum, it would just be an indicative referendum. It wouldn't be binding on the planning committee. The planning committee wouldn't have to take it into regard. The statutory public consultation would need to be considered by the planning committee and would form part of their overall decision-making process, but that would only apply for the statutory public consultation. Obviously, they could consider the local referendum, but it doesn't carry the weight, obviously, of a statutory consultation process. And again, you're correct that this council couldn't introduce a policy via a motion that would tie the hands of the planning committee. The planning committee is a statutory committee and makes the decision based on planning policy and guidance. And in relation to Councillor White's point, he is correct that obviously any planning decision is subject and can go to the planning inspectorate.
Thank you. Thank you, Kelly. Is it appropriate for the planning officer to come in, or any need for him to make comment now?
I don't feel there's need for the planning officer to comment.
Okay.
I'm not sure if he's here.
Okay, thank you, Kelly. I have no Councillor Charles Smith. You have a point of order.
I do have a point of order. Councillor Young raised some questions to be answered by Councillor Gifford. I feel that we ought to ask the planning officer to give his version of the answers to those questions, please.
Is the planning officer there, please?
Hello, Mr. Mayor. I am here. I have been listening and taking everything in. I'm not really sure where to start with this one, but I think I'll sort of give you a little bit of a brief overview of the planning position in relation to the motion, which fundamentally I don't have an issue with. I think what's said in there I support wholeheartedly. But as Councillor Young has pointed out, this is something we're already doing. Our open spaces are already protected in the current development plan. They will be protected in the forthcoming development plan when that's adopted. We are obliged under planning law and regulation to consult, and planning is probably one of the most consulted on functions that the authority has. We have to consult some neighbours if somebody wants to put a conservatory up, for example. But on a development plan basis, there are key stages during the preparation of that plan where we have to engage with the community. And we've done that. We've already done that to a degree when we looked at our strategic sites. And some members here will remember when we brought reports to council on our strategic, our strategy then for the new plan. And once that was approved by council, we went out to the communities to engage with them. We actually took on, we used an outside agency to do that work for us. because we felt it was important enough to actually get some outside help for people for this agency to actually go into the communities and engage. And we'll have to do that process again when the draft plan is published early next year. We'll have to do the same process again. And Welsh Government are very, very keen for councils to, even during the COVID crisis, still have to maintain that engagement with the public. And some members will have heard me say this before, that the LDP is probably the biggest single piece of work that this council will undertake in terms of its evidence gathering. There's a lot of evidence that we have to gather. Part of that is the open spaces audit, which has been referred to, and that is ongoing now. That work is actually taking place now. We have to engage with the public. We also have to comply with various complex legislation and regulations, because if we don't do that, that plan isn't regarded as being sound and being valid. And also, at the end of all of that, once we've done all that work, once we've taken everybody's comments into consideration, we then have to submit it to Welsh Government for independent scrutiny by a planning inspector. And that scrutiny could go on for weeks and weeks and weeks. And I think the last one was 6 weeks, and the last plan was in scrutiny for an examination. And only then, once the inspector is satisfied with the plan, he refers it to the Welsh ministers, and then the Welsh ministers make that decision as whether that plan can go ahead, and it's only then that we can bring it back to council for adoption. So the amount of scrutiny in that plan and the amount of engagement is considerable. So I don't think that that is really in question here. And the policies that we have in the current plans I mentioned, they do support our open spaces. They do give them priority, and that's also reflected in national planning policy. National planning policy also now has embedded in it the Wellbeing of Future Generations Act. So it adds another layer of accountability in our planning system. And as Councillor White mentioned or asked previously, yes, there is more emphasis now on preserving open space, preserving and the wider ecology benefits that come with it. But it's not just open space for the sake of it, it's open space that has a function, and that's a lot of that is well-being, and that's been identified more recently perhaps, and Welsh Government has reasserted the importance of public open space in recent documentation. That's now planning policy. So hopefully I've sort of covered the sort of planning position on these points, but I can assure all members that as a planning authority, as distinct from the council, as the local planning authority, we are covering all these areas and more in great detail in our development planning system and in the day-to-day planning decisions that we make. Thank you, Mayor.
Thank you, Jonathan, very much. I hope that's very helpful for many of the members listening. I have two other councillors who've indicated they wish to ask a question or make a comment, and that is Councillor Tim Thomas first, please.
Thank you, Mr. Mayor. Yeah, I very much support the motion, including the part about the referendum, actually. If we use the example of the development in the proposed development in Tondy, where there was considerable debate, I believe that the proposal was 350 houses west of Maesteg Road. If there was a referendum in that proposal, it would have overwhelmingly been against. And I'm just not convinced that the current system for consultation is adequate. In that particular planning application, several community councils objected, the MP objected, local AMs, regional AMs, both myself as local member and the member for Aberkenfig, James Radcliffe, also objected. Thousands of people turned up to public meetings, yet that enormous weight of objection was ignored. And I accept the point that a referendum still wouldn't be legally binding, but it would give members an added indication. So for that reason, I will be supporting this motion.
Thank you, Councillor Thomas. The next one, Councillor Stuart Baldwin, please.
Thank you, Mr. Mayor. Yes, I just want to speak in relation to the motion around the fact that councillors and members of the public already know that there is a robust consultation process in place in Bridgend County Borough Council that has been used across the whole county when looking at changes and the impact of cuts to services. As we are all aware, the Bridgend Town Master Plan is currently out to consultation to the whole of the county. It is a county issue, and therefore every resident of Bridgend County has the right to have an opinion on it, not just the 3 wards that are related to Bridgend Town Council or Bridgend Town Council area. What concerns me at 3.3 is the use of the term local referendum. Irrespective of the content of this motion or the location or ward that it relates to, this motion offers what I believe to be a dangerous precedent. No one doubts that residents have to be consulted and their voice heard throughout the development and delivery of our services. However, to allow only the voices of one ward to decide on the outcome of a project that benefits the whole county is not what I consider to be democracy, and what I believe could be open to accusations of NIMBYism. A councillor does not only act for their own ward, they must balance this with the decision making, developing and reviewing council policy, scrutinising decisions taken by our cabinet, and also the regulatory, quasi-judicial and statutory duties that we hold. Now, the motion already recognises that the review of outdoor sports and children's play space is being undertaken as part of the proper process with the LDP. This council already operates in line with the Wellbeing of Future Generations Act. As part of the COVID-19 recovery panel, we have already recognised the importance of open spaces, and the PSB community impact assessment has formed part of our evidence base and use, and we continue to look at the impact of the pandemic. Yes, the council we could consider resolving to sign the charter. We already work to protect green open space in our new and existing communities, but not at the detriment, I believe, of other services and areas. We cannot and should not be holding a local referendum that will hamstring this council or our quasi-judicial processes as part of a council. Thank you very much.
Thank you, Councillor. I have no other speakers other than Councillor Richard Young wishes to come back in for, I think, clarification. So, Councillor, would you like to speak?
Yeah, thanks, Mr. Mayor. Given the fact that we've heard from both the monitoring officer and the planning officer that such a referendum wouldn't hold any weight in the planning decision, my real fear is that what we will be doing with this motion is raising people's expectations above anything that we can deliver. So that is my real opposition to this motion, Mr. Mayor, is that one clause. Having said that, everything else in the preamble, I do thoroughly agree with. And I would welcome a motion being brought forward which requested us to sign to the objectives and the goals of the Placemaking Wales Charter. And I feel sure that that would be supported wholeheartedly by this council.
Thank you, Councillor Young. Councillor Gifford, you have the right of reply now before the vote is taken.
Sorry, just as a clarification, was that a formal proposal from Councillor Young to remove that clause, or was it?
Councillor Young.
Thank you, Mr. Mayor. No, I believe that such a motion should come from the floor of the council, and on that basis, what I said was I would welcome a motion.
So that would be a new and different motion, is what you're saying. So I think we need to hear from you now, Councillor Gifford, to sum up your points, please.
Yeah, thank you very much, and I'll try and keep it as brief as I possibly can. I know a number of the points that have been raised, particularly around the legal aspect of this, have been answered by the monitoring officer and planning officer and others. Councillor Spanswick and myself consulted with officers throughout the formulation of this motion, and you yourself, I'm sure, Mr. Mayor, will be aware that we've held those meetings, and those have taken place. So it's, as the monitoring officer kind of reiterated, it's an entirely legal motion, and it's one for the council to decide whether it wishes to back or not. I just wanted to follow up on just one or 2 points very briefly. First of all was a point Councillor Young made about sections 1 and 2, where he asked what part of the motion does the council not already comply with, and he is entirely correct. The council does comply with what is stated in 1 and 2, and that is why it's written as an acknowledgement and not a resolution. It acknowledges the fact that the council is already linked with the Future Generations Act and many other schemes as well. That is the purpose of why it is there, to acknowledge what the council is already signed up to. And secondly, I just wanted to clarify what sort of Councillor Baldwin and Councillor Tim Thomas both said about the impact of a referendum. And I think the example Councillor Thomas gave was a very pertinent one, about perhaps how many of our constituents feel about the planning process at the moment, and his example was a very good one about the lengths that he and others went to and I will admit I don't know the specific project he mentions, but it is a familiar story, and I'm sure many members will have their own ones right across the borough of objections coming in from all angles, and unfortunately residents not feeling that their voice matters. So ultimately, you're correct, as we established at the beginning with Councillor Sturman's motion, that this wouldn't be a binding referendum, and we couldn't tie the hands of the Development Control Committee to do that even if we wanted to. But in my view, it would take a very brave council and a very brave committee to go against what the public wanted. So in my view, this motion puts the power back in the hands of local people, and that's why I'll be supporting it today.
Thank you, Councillor Gifford. I think we've had a good and open debate on this now, and I believe that the proper way forward is to vote on this. Kelly, do we go forward on a normal vote process, please?
Yes, the Democratic Services Officer will have got a register essentially, so they will do a roll call of names, very much like we did in the AGM. If people could say whether they support the motion or reject the motion. I can see that Councillor Gifford has called for a recorded vote. Yes. What we did in the AGM is, because it's essentially recorded anyway, because we do in the register, we didn't have the separate vote on whether it should be recorded, and we did that with the consent of the chamber. So if council are happy that we use the register as the recorded vote, we can proceed in that way.
Is our members content with that?
Yes, I am.
Can I clarify that very quickly? Sorry, as it was my request. Would the public would be able to see which way each councillor voted if they were requested under that system, Kelly?
If they requested it, but obviously this is being recorded, so they will hear the member saying which way they're going to vote anyway.
Okay, but if someone contacted, say, Democratic Services to find out, that would be publicly available information that they could be provided with?
Yes, yeah.
Okay, fine.
Okay, then Kelly, Democratic Services, Andrew, will go ahead with the recorded vote then, please.
Thank you, Mr. Mayor. For the benefit of the recording, my name is Andrew Rees, Democratic Services Manager, and I will now take members through the roll call. Firstly, Councillor Alex Williams.
Abstain.
Councillor Altaf Hussain.
Support.
Councillor Amanda Williams.
Support, please.
Councillor Pacella.
Support, please.
Councillor Brian Jones.
Support.
Councillor Sedgbeer.
Reject.
Councillor Webster.
Support, please.
Councillor Charles Smith.
Reject.
Councillor Green.
Support.
Councillor David Lewis.
Reject.
Councillor David White.
Reject.
Councillor Patel.
Not in agreement.
Councillor Howells.
Reject.
Councillor Gary Thomas. Councillor Gary Thomas.
Shall we come back to Councillor Thomas at the end, Andrew?
Yeah, certainly. Yeah. Okay, we'll move on. Councillor Hugh David.
Reject, please.
Councillor Howell Williams.
Against.
Councillor Radcliffe.
Support.
Councillor Gebby.
Reject.
Councillor Janice Lewis.
Reject. Sorry.
Councillor McCarthy.
Reject.
Councillor Blundell.
Reject.
Councillor Julia Williams.
Reject.
Councillor Keith Edwards.
Abstain.
Mr Mayor, Councillor Watts.
Abstain.
Councillor Lynn Walters.
Support.
Councillor Malcolm James. Councillor Malcolm James.
Support.
Andrew, I've had a message from Councillor Gary Thomas. He says his mic won't come on, but he's against.
He's against. Okay, thank you, Mr Mayor. I shall record that as Councillor Thomas voting against. Councillor Matthew Voisey.
I think he's left the meeting, Andrew.
Okay.
Councillor Mike Clark, can I ask you to put yourself on mute? I think we're having a bit of feedback from you. Thank you.
Councillor Mike Clark.
Support.
Councillor Kern.
Reject.
Councillor Burnett.
I'm against the motion.
Councillor Nora Clark.
For.
Councillor Pam Davis.
Against.
Councillor Paul Davis.
Reject.
Councillor Phil White.
Against.
Councillor Collins.
Reject.
Councillor Granville.
Against.
Councillor Young.
Against.
Councillor Shaw.
Against.
Councillor Penhale Thomas.
In support of the motion, please, and thank you.
Councillor Sturman.
Support, please.
Councillor Vidal.
I support the motion.
Councillor Dendy.
Support.
Councillor Stephen Smith.
I'm against.
Councillor Baldwin.
Reject.
Councillor Thomas. Tim Thomas.
Support, please.
Councillor Beadle.
Abstaining.
Councillor Gifford.
Support, please, Andrew.
Okay, just members, if you bear with me, I'll just total up my workings out. Okay, I should like to announce the vote. Those members voting in favour of the notice of motion were 17 members. Those voting against the notice of motion were 25, and there were 4 abstentions. Thank you, Mr. Mayor.
Yes, thank you, Andrew. I lost contact briefly during that, but I've relogged back in, but I've lost all my instant messaging, so if anybody was coming through, I haven't got it, but I am back in now. So the motion is lost. Thank you. So moving on to item number 10, please. Urgent items. There are no urgent items. So I ask the Monitoring Officer Kelly to come in on item 11, please.
Thank you, Mr. Mayor. This item is about exclusion of the public. All members are very aware of the process here. You will aware that the general requirement is that you as members conduct your decision making in an open and transparent manner. However, there is legislative provision to allow some matters to be dealt with in private, and the report you have at item number 12 contains information that meets the criteria for exempt information. Not only does that report contain commercially sensitive information relating to the authority, it also contains highly commercially sensitive information relating to third parties. On this basis, I would advise members to apply the public interest test and determine whether they will deal with this item in private session to maintain that confidentiality. Thank you.
Okay, members, do you wish to continue in private on this item, please?
I move, Chair.
Seconded?
Second, Chair.
All in favour?
Yeah.
Aye.
Thank you. Okay, I previously arranged with Andrew when we got to this point and Kelly that we would have a 3-minute break because the recording has to be finished and Andrew has to make sure that press and public have in fact logged out. So we are now having a 3-minute break, which will take us to